This one's especially for the C-section mamas out there. 1 in 5 women worldwide give birth, have a C-section. I had mine due to complications in pregnancy, and I'm so grateful to have a healthy child, and I'm healthy, and it was all good. But I'm experiencing a little bit of low back pain, and I wanted to show you this thing that nobody tells you about that will pretty much change your awareness if you have had a C-section and you suffer from lower back pain. So basically what happens is when they cut you through here, we rip through, and the fascia, it creates scar tissue in here. So what happens is this whole front chain of your fascia, this is the reason why I have this band, is to show you that right here, we have equal tension here on the front and the back. But then when you have a C-section, this part gets cut and shortened. And what happens is it starts to pull down, it starts to tug, and the backside pulls up. So instead of just this neutral balance that you're supposed to have, us C-section women, we have this. Okay, so what happens here? It puts a lot of pressure on the pelvis and it tugs up here. So how do you unwind it? I am feeling a little bit of low back tension because I was just doing a road trip and I just drove in a car for 9 hours in the last couple of days. And so I was sitting in a position that further exemplified my forward posture in here. And so I'm having the stiffness, not just because I was sitting in a car, but I do have a C-section scar. And here are a couple ways that I help to address this on a daily basis. So I hope that this creates an awareness shift in your body as you're exercising. What you need to do is you need to rebalance this side and you have to strengthen this side. So we want to have a nice symmetry on the front fascial line and the back fascial line. And I do this with myofascial release and strength training. 3 easy ways that I help to realign my fascia and find balance between my posterior chain and my anterior chain, especially since I have a C-section scar. So first, I'm going to try to create some length in the front chain. And first, I'm going to get into my hip flexors and my quads. Okay, so I'm going to get in here with the travel roller, gets super deep. And I'm going to do the this is how we roll method. And I'm going to get deep into the hip flexor. And I'm going to apply upward dog. Stretch this way. I'm really going to get in there. So I'll do this on both sides. I'm going to release this chain, the tightened and shortened area, and then I will manually go into my C-section scar and I will start to open it through here. So I'll grab the skin and I'll pull. Okay, I'm going to show you guys that. I actually have a full course on my pre and postnatal recovery in my travel roller app. If you want to learn how, during all stages of my pregnancy, I shared my journey in there. So I will release that in there. Secondly, I'm going to stretch it. I'm going to get a real deep stretch in my anterior chain. So I either on a couch or a wall, I use my travel roller as a prop. I'm going to get in this position. It's going to be a hip flexor quad stretch. Okay, but I'm going to hold in my core. I'm going to lift up, use my travel roller for balance, go back as far as I can. I'm going to put my arm up. I'm going to breathe, lean back, and I'm feeling this whole chain open up. Okay, I'm going to hold that stretch. If you can't go very far, you can just do this position and go back, or you can try on the ground as well and reach in there. Okay, do both sides. And the third thing I'm going to do is I'm going to strengthen my glutes. So it could either be a bird dog or a glute bridge, anything that gets those glutes pumping. Also a deadlift or a lunge, something that isolates the glutes. I have a reverse hamstring curl machine and I also do reverse hyper. So this is a bit more higher level, but if you want to just go with the basics, just to get those glutes going, a glute bridge, an alternating glute bridge, anything that really rebalances the body would be awesome. All right, so those are the things. The C-section scar is pulling me down this way, and it's hard to engage my core, hard to engage my glutes, and so I'm reversing it by trying to rebalance that symmetry. Not only looks better aesthetically, but also it's just creating balance back into having enough muscle on the glutes and hamstrings. Okay, you want to have that balance and in the front so that you have the nice symmetry, but you also feel well and you don't have any pain. So I hope that helps you with your C-section. And remember, I had mine like 9 years ago, so I'm still feeling it. It's something that you're going to have to manage for the rest of your life.